Hi guys, it's Dr. Sullivan from Physio. I'm outside enjoying this lovely day here, and I wanted to reach out to you guys and talk a little bit about posture. It's definitely a topic that gets a lot of traction, particularly in my field, but in the health and fitness industry and all, I mean everywhere. You say the word posture, and the whole room, everyone sits up a little bit taller, stands up a little taller. So I wanted to just address something that's really super common for people that have neck pain, they have shoulder pain, they'll have upper back pain, sometimes even chest or rib pain. And it a lot of times stems from, or even headaches. A lot of times stems from some of the ways that we change the way we hold our bodies to try to make it feel or seem or look like we have better posture. Which, by the way, we're not posture police. Posture is a huge part of dysfunction and can be a huge contributor to dysfunction. But just lifting up your chest is not necessarily the best way to go about it. And that's what we're going to kind of highlight today. So I have Oliver here with me today, and he's going to be our model. So Oliver, I'm going to actually go this way. So we're outside, so I don't need to be wearing a mask. It's really fantastic because I'm not going to be breathing at Oliver, and we got a nice wind coming. So what you can see from the side and Oliver, I mean, he's got some pretty decent posture. You see how he's upright, right? You can see how everything kind of stacks on top of each other. But what you can also see is how his pelvis is a little bit forward and his rib cage is a little bit backwards. But what you'll mainly see is while he's standing here, he's pretty upright, but his shoulder, can you see how his shoulder kind of likes to dip forward a little bit? And he counteracts that a little bit by the way he carries his rib cage. So if I ask Oliver to actually relax his chest down, which is something that a lot of people have difficulty doing, they don't even realize that they're doing that, and I'm sure he doesn't even realize he's doing it. But if we let that chest relax down, you can sort of see a lot more of how this all kind of rounds forward. And so that's a very different piece of this puzzle. So we have the rib cage, so we lift the chest up and then we drop the chest down. So we have that component. We have this rib cage component of posture, which feeds into the spine, right? But we also have the whole reason why people end up thinking or feeling like they have bad posture, and that has a lot to do with this whole shoulder complex. So as this shoulder, the front of the shoulder gets tight, or the back of the shoulder gets weak and loose, or whatever, all these other things that feed into it, the shoulder tends to rest in front of the rib cage. And so instead of changing the shoulder, we tend to change the ribs, and we tend to change the chest like this. So rather than going that route, if we were to let the chest down, now I want you to, your goal right now, Oliver, is to keep this chest down, keep it relaxed down. Let me move this shoulder. And what you'll see is if I'm allowed to move this shoulder and do a little bit of, look straight ahead, to kind of move this shoulder so it sits on top of his rib cage, can you see that from the side, we instantly change his posture? And that's just by moving this. He's actually done a very good job at keeping his chest down. So we haven't done anything about moving his chest. All we've done is move this shoulder. So you can see the difference there. Now, if we let the shoulder kind of come back, that's sort of where it wants to live, right? So if we put the shoulder back on top and let the chest down, what we don't get is all the other things that come along with the raised chest. So relax your shoulder here, and I want you to exaggerate, like puff up your chest. So what you can see, if he exaggerates, and again, it's an exaggeration, but what happens with the rest of his body, he gets a lot more of this curvature here. What'll end up happening is he's not going to be looking up at the sky, so what he's going to do is he's going to move his head down, and eventually it's going to start to slide forward this way, so we get that forward head. Our eyes like to stay on that horizon. So really my main point here is the shoulder itself a lot of times is the cause of this bad posture thing that we see, and a lot of times we compensate by using our rib cage or our chest to sort of counteract that. So what we would do here with Oliver is we would work on trying to be able to get this, as I'm trying to move his shoulder girdle back to where it should live. There's a lot of restriction here on the front of this rib cage through here, and lots of pulling through underneath the collarbone and things like that. So that kind of restricts his ability for this shoulder girdle to sit well on top of the rib cage, and so it falls into the sort of trench in front of the rib cage, and so we're left with just the tilting of the rib cage in order to compensate for that. All right, so just some things to think about and how we go about treating posture, so to speak, and how that feeds into some things. You guys have questions, shoot me some comments, shoot me some messages, and we'll take care of that. Hope you guys are out there enjoying this wonderful day, and we'll be in touch soon.